All right, we're going to do pharmacokinetics chapter 2, and we're going to basically move it. We're going to figure out how we're moving these drugs through the body and getting them and all the processes that kind of affect the drugs as they kind of progress through the body, and really how that affects the actions of the drugs and the dynamics that the drugs can take. And so you can see this is basically the from start to finish. How do we get them in? How do we distribute it? And then the body's going to break it down and get rid of it. And so that's kind of what we're looking at. Before we jump into the concepts here, I want to make a couple notes in your text. The foundational concepts like site of action and onset of action, duration of action. These are all concepts that you can look at. I did want to just, mention half-life because I talked about that in the dynamics part. So that's on page 18 and you can look at that. And then really we start talking about bioavailability, and I guess bioequivalence is kind of thrown in there as well in this chapter on page 19. And ultimately, we're talking about how much of a dose is available to our body. How much can we get through? And so, especially when we're talking, if we're taking drugs orally and we're trying to put them through our gastric, process, our gastrointestinal system, getting through the stomach, getting through the intestines, it's going to go through the liver. And then, at each stage, we're breaking parts and parts and parts down, and we may only get a small amount of this drug into the bloodstream, and that's only the first time through, right? And so, as it circulates throughout the body, it's going to come back through the liver, and even more is going to be broken down. More is going to be broken down. You do need to know the first pass effect, and that's on page 19. Look at that, but it's a pretty self-explanatory kind of process. Other things that can affect bioavailability is, sometimes drug manufacturers will just kind of change the way they package their drugs, especially if it's going in orally, and they may put coatings on it or do chemical makeups to, extended releases, those kind of things. There's a lot of different things they can do to kind of try to get through that first pass effect and get that blood or get that drug out into the bloodstream and that kind of stuff. Sometimes you may have to just avoid the gastrointestinal system altogether and just, go directly at it. And sometimes injections become the preferred way of getting drugs to a specific area. Once we get the drugs into the blood flow, then that's when the drug itself is looking for wherever it's headed, whatever receptor, whatever site of action, that it's going to go exert its pharmacological effect. And you can see the first one, that's obvious. If the areas with the most blood flow is going to get a more of that drug exposure to that. As we get into those small little capillaries and into into those interstitial out in the fingers, you're not going to get as much out there because there's not as much blood flow as you go. The brain needs a lot of blood, but there's an extra layer. So now there's this extra lipid layer that drugs have to pass through. If they're not lipid soluble, right? If they can't just dissolve, which most drugs can't, there's got to be some way to get that into, if we're trying to affect the brain and that kind of stuff. Other couple of concepts to note. And chapter 2 kind of continues to go over this, looking at page 20, volume of distribution, protein binding. That's where this stuff kind of goes. So as we dissolve, as we get the blood through whatever, first pass or wherever we want it, into the drug is into the bloodstream. Now what we have is we're dissolving that drug into a specific fluid. And so as it gets there, we go back to a lot of our basically fluid dynamic principles. You guys probably talked about this way back in physiology or anatomy. When you look at this first one, the smaller amount of water the drug is kind of sitting in, the more concentrated it is. So if you look at this picture, I got this picture, there's a lot of people in the pool. If we cut that pool in half with the same amount of people, then it's going to be a lot more crowded. It's a lot more, more intense and more. It's going to exert way more of an effect, kind of thing. Just think about this: if everybody in the pool is peeing in the pool, right? The bigger the pool you have, the less really effect that it is. If you have a small pool and the same amount of people are peeing in the pool, it's going to have a big effect. I know that's kind of a brutal one. Lipid soluble, right? So, is it water soluble? Does it dissolve in water? Does it dissolve in fat and that kind of stuff? Your text, continues to talk about this. It does talk about the plasma protein. In fact, many drugs, as they get out into the blood flow and into the systemic circulation, they get attached to plasma proteins because they're out there in that white, in the white blood cells or in that plasma part of it. And so ultimately, that's not really good for drugs that want to go do something or create some kind of pharmacologic effect, because drugs themselves have to be plasma protein free. They need to be free from the plasma protein so that they can attach to their little receptor sites and that kind of stuff. And so sometimes that's another complication. Another little complicating factor of trying to get enough blood or enough drug through into the bloodstream. How are we going to do that? Are we going through orally? Are we going to inject it? How, transdermally? How are we doing all that kind of stuff to get as much of a chance of this drug exerting its pharmacological effect in the body? The cool thing here is that a lot of drug companies, pharmaceutical companies, know this, obviously, and so they'll package their drug, whatever the drug they want to get through to the receptor, but they'll package it with something else that has a high affinity for plasma proteins. So those plasma proteins can be taken up by this extra inert, non-effective, non-therapeutic substance to allow the actual drug that gets through to be able to just go right to those receptors and not have to be taken up by plasma proteins. So there's a lot of, obviously, chemistry that goes through as we go through there. The book does talk about, passive and active supports, and that's when we talk about the different levels of solubility, and just kind of reminding you, if something is hydrophilic, it's going to be much more dissolvable in water and that kind of stuff. Somehow, how to get across barriers. How do we get across specific barriers? And that's, I think I have a picture coming up. There's my oil and water. Yes, there's my good picture, because this has the passive transport, high concentration to low concentration. Sometimes there's actually the facilitated part is where it goes through a protein. There's actually a little protein molecule within the cell membrane. And then the active transport actually needs some type of energy expenditure. There's a pump or something that has to do that. So really, you should just have kind of this is just, hopefully, I'm not bringing back, bad memories of your anatomy, physiology stuff about passive and active transport, but you should have an idea if the drugs are talking about it diffuses passively, or if it's a lipid soluble drug, that's going to passively dissolve within the cell membrane and get to cells much easier than a water soluble drug that needs some kind of facilitated diffusion, or it may even need some actual active process to do that. So here's the other, I just talked about that. I do want to talk about something that's not, I don't think it's in your text as much. You may see this. Basically, some drugs are ionized and have some kind of a charged particle component to it. You can look at the bullet points here. I think the important bullet points that I want you guys to realize is just recognizing you may see, ionization is part of the conversation when we talk about drugs. Drugs ultimately, for the most part, need to be unionized, charge-free as they cross cell membranes. You can see some of the bullet points here. This is kind of interesting. It does figure, the manufacturers, pharmaceutical companies, will ionize or unionize, basically charge their drugs to be absorbed in specific areas. They may want them to be absorbed in the stomach, so it doesn't even get to the liver and get broken down and that kind of stuff. And so there's a way to do those. But ultimately, the biggest one on this is beyond just knowing that there's, some drugs have certain charges, which we call ionization. This last one is the key. Drug ionization determines route of administration and where the drug will be absorbed. You can add that on there if you want, because Will Smith will appreciate you for that. Then the book starts talking about, all right, how do we get these, what are those routes of administration? I've been talking about oral or injections or that kind of stuff. So when you look at the different types of how to get how do we get the drug into the bloodstream, right? So this is easy. right? So we can just do an easy injection. We bypass the GI tract. There is no first pass effect, and we deliver it right to the place that we want. Great. Works for anti-inflammatories, works for pain meds, those kind of things. Most of it is, most of the time we take drugs, we take it orally. And so depending on the drug, and, it may absorb in different places along that GI tract. It does take a while to do that. It's not as quick as the injection side. So you can kind of see some things. There may be some side effects we've talked about, side effects, or taking anti-inflammatory medicines like Aleve and ibuprofen with food. There's a reason for that. I'll talk about that when we get to those drugs, that kind of stuff. They can be transdermal, definitely inhalation, and then within our mucous membranes as well. So all of these are bypassing that gastrointestinal tract, that first pass effect, and so we may be trying to get them directly into blood flow without blood circulation kind of thing, without getting through the GI tract. The end of your text talks about, where is that? Come on, click it. Is how does exercise affect how drugs are going to move through the body? So does exercise affect it? Well, the easy answer is yes. The hard answer is how. Your book talks about it a little bit. If you look at box 2-5 on page 37, there's a number of general bullet points. When you read, I want you to read through those, because that's going to be a good one to have. I put some stuff on here that I can talk about, but ultimately go to box 2-5 and there's some general stuff. I do have an article that I have for you to read, and it has some information on that. But if you think about things, really, I just want you to think about exercise physiology. When we exercise, stuff like blood flow, right? And we just go like this one. If I take an oral medicine and then exercise and reduce blood flow to the GI tract, and how quickly is that going to move the same speed? It's going to slow down, right? That absorption part is going to slow down because my body is shutting off. The parasympathetic issues are shutting down because we don't need digestion right now. We don't need a bunch of maintenance stuff. I need to exercise. And so, yeah, that affects it. If we do an intramuscular injection and then we push a whole bunch of blood flow through the muscle, is that going to absorb quicker? I mean, it sounds like it will. And so there's a number of things like that, especially if you're taking an oral or an inhaled drug, right? And now we're going to be breathing a lot quicker. Our respiratory rate goes up. So there's a lot of those things as you read through those. They are just having an idea of what the physiologic effect is from exercise, helps you kind of get an idea that this might be affected. I keep saying might be affected, right? I keep saying, it might be affected. It is, and sometimes. This is directly from your book. I had this on my PowerPoint before I was even using this book, because I love this. Pause this and read this, because this is, what the heck are we talking about? Read that. Just read it for a second. And I'll just pick out some words that really give us the. I got some drugs, some patients, right? Exercise could have, right? So we have that. Then a potential, right? There is difficult to predict, but there's a potential for significant impact. You're thinking like, come on, man, what do you want me to do here? So look at the article, look at this box here, get an idea of, yes, how it possibly could be affected, and that will help you answer some questions that you get on how exercise affects drugs going through the body. All right, now I'll show you my kitty who's fallen asleep, and a nice fun picture. That's not me. That's all.